suck all the air out, and
Tissue,
suck the lungs out.
you know, all kinds of stuff out.
You don't wanna do that. Okay, so that's why they have 3 different kinds. Tell me, infant, what's the pressure?
60
6
to
to
80,
8.
And children?
80 to
80 to
100,
And adult?
100 to 120.
Yeah, that's easy. And make sure you occlude it and do it, okay?
Are these universal? Like Kathy's not going to tell us different numbers?
No, this is universal. You've been teaching this for years and years, 25 years or so.
But she will tell us it.
Would you just go right in the middle of that typically, or does it depend on the size of the person?
If I see a patient with a lot of thick secretions, it's not really working with 100, I will turn it up to 120.
Okay.
That's how it works. If I don't get anything, I can turn it down. It depends on the secretions. All right. So after you set everything up, now the fun part begins. Now, can I have this little table here? Okay.
Yes.
We're going to do a nasotracheal suction. Okay? And your hand out. Look at your hand out. Nasotracheal suction. All right, this is easy. No. Kathy, can you put this patient on the This is your check off.
You guys doing that backwards in the hospital last night. I thought they
She said, I'm gonna
Which
beat
one?
you.
Which, this one, this is got straight.
You did a fine job, Kathy.
You know he's setting up.
Isn't that big enough ear?
It's harder than it takes to
You're losing your head.
He has no ear.
I know. His head won't
Yeah.
fall back.
But he did it right.
You could take his ears.
Very good. Now, you walked in the patient room doing a breathing treatment. I had right the doctor's office. And after that, you asked the patient to cough. This man is junkie. He can't cough. He has very weak cough. So, how can we get this secretions up? Well, the doctor, meantime, walked in and said, can you suction this patient? How do you suction? That's what we're going to do right now. He's on a nasal cannula. He's not intubated. And first of all, we need to do what? Wash your hands and put on non-sterile gloves. Before that, there's a step. If you put non-sterile gloves, I'm sorry. Yeah, put on non-sterile. So wash your hands, put your gloves on. You're walking in. Assess the need for suctioning. How do you know this man needs suctioning?
You can't listen.
Hear it.
You can't
You
hear
listen
himself.
to his breath sound. And what is the breath sounds now? Hoarse crackles. If it's fine crackles, are you going to suction the
Yeah,
patient?
you can't get down that far.
There we go. If it's diminished, can you suction the patient? Okay. Any other sounds you don't need to suction? If you hear wheezes, bilateral wheeze, what are you going to do? Suction or give a bronchodilator? There you go. So, coarse crackles, you said, all right, this patient needs to be suctioned. You assess the need. Place the patient in Fowler's position. Remove the pillow from behind the head. So you have the patient in Fowler's position. You took the head. You explain the patient, okay? Okay, you need to tell the patient. You just don't go in there and start doing all this stuff. They'll kick you out of the room. How do you tell the patient? I'm seeing this as an issue because you guys don't have enough experience talking to the patient. How do you tell the patient?
If the doctor's ordered it, come in there and you tell him that the doctor has ordered,
I don't want it. You didn't convince the patient. You really had to convince the patient. Because you're doing a procedure, there's a catheter that goes through the nose, through the lungs, right? It's gonna make them cough and gag and all this. It's not
Pretty safe.
pretty, yeah. So you really have to tell them, sir, you can't cough, you can get the secretions up, and your oxygen level is down. If we need a suction, you get all the secretions up, otherwise, we probably will have to put a tube down your throat and put you on a machine. It's not a good thing. So you really have to, like yesterday, I had to tell them,
Put them in a nice way.
yeah, yesterday, this
down the
lady,
nose.
this lady was breathing like 50 times a minute with a heart rate of 170. She will not leave that mask on, the BiPAP machine. I told her, you know you're gonna die if you don't put this mask on. We have to put this on. She didn't move. I mean, we put it on her, and they had to give her some more sedation.
I don't know, after you said die,
Uh-huh.
her eyes went like this, and you put it on, and she was like, help me. And she stopped saying it again. She just put it on.
Quieter.
Yeah, I mean, the thing is, my goal is to get her better. I don't care what she thinks. But, you know, if I don't do it, she's gonna die. You know, I care about my patients. That's why I do it. Sometimes you gotta talk to them that way. So you tell them, you convince them, okay? So then they say, okay, go ahead, whatever. So, you did that step. And hyperoxygenate the patient for 30 seconds. How can I hyperoxygenate this man over here? The one on the nasal cannula. Can I turn the nasal cannula up to 15 liters?
No.
Blow his nose off?
No.
How do you hyperoxygenate? Yay! This is it. Okay, I'm gonna pick up this normal breather, attach to the oxygen, turn it up, fill this up. I don't have any oxygen, so I can't do it. And put it on his face. For how long?
30 seconds.
Okay, leave it on. Leave the oxygen on the patient's face. You can do that on top of the nasal cannula, doesn't matter. All right, now have the patient take slow, deep breath. Take some nice, slow, deep breaths. Use ambu bag if patient is unable. Well, obviously, the patient has to be breathing deep, right? If the patient can't take deep breath with the normal breather, what are you going to do? You're going to assist them with an ambu bag on that face. Breathe. Breathe. You know, you assist them, giving them 100%. Okay? You don't need a normal breather and an ambu bag together. Either one. Okay? Now, monitor the patient with a pulse oximeter. Well, you don't have a pulse oximeter with you, so you go outside and ask the nurse to give you a pulse oximeter. You come in and put it on his finger. Now you're monitoring that. Okay? Turn on suction regulator to appropriate pressure, which we already did. This is a guy, adult, so we have it on what pressure?
80 to 100.
Somewhere in that range, okay. Open sterile suction kit. Oh, now the fun begins. You put this on the side table. Make it comfortable. When my patient is over here, I have it sitting right here. Open it up.
Now, you already have on your other gloves.
Yes, I already have the other gloves.
Okay.
What happened?
They're back there getting coffee.
Okay. It's alright. Maybe a little bit. Yeah. So, yeah, okay. Open the sterile kit, open glove wrapper without touching gloves. Okay. Place water soluble lubricant on corner of